Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Menzies. Good morning, Dr. Mencia. I don't think we're going to have rain today.
No, no rain. Not right now. Not yet.
But in our studio, of course, we have a lot of bright stars. So we have a special bright star that you brought. You want to tell us a little bit about Alan
even
Borman?
Even after sunrise. Well, Sheldon Worman is a good friend of mine. He's a physician. And we know each other for, probably over 20 years that I've been here in South Florida. And I came across this young guy, and I see, look a little bit like Sheldon. And, we met, and I said, you have to come to the radio show. What an interesting person. And when I saw him, I first saw you in the waiting room.
Yeah, the lobby of
the office of AGI. And I see him walking around. The last thing that I crossed my mind is that he himself is an amputee. So we were talking about prosthesis, and he said, "Do you notice I'm an amputee?" I said, "No."
How would you know? It's gorgeous. I mean, it is the most beautiful leg that isn't really his own.
Right.
Well, I was teasing Dr. Mencia out in the area, what I'll call the green room for you guys.
Okay.
And I referred to my left side, which is my natural leg, which I call the OEM, Original Equipment Manufacturing. And my right side, which is where I wear my prosthesis, I'm a right side below the knee amputee. And I had called that my aftermarket. So for me, fortunately, the company that I do consulting work with and my company that makes my prosthesis, they've been great at producing a good product. So, and also I had good physical therapy and occupational therapy, which I also teach at schools about prosthetics.
Well, I have some questions. I'm sure Dr. Mencia knows these answers, but how long have you been an amputee?
I've been an amputee since 2009.
Oh, and would you have ever imagined that this would have happened to you?
This was what caused my loss of limb came on suddenly. My first symptom was on a Sunday. On a Monday, I went to go see my primary care physician. Didn't see any problem. I went right afterwards to go see my orthopedic surgeon because I was having pain in my ankle, which I never have pain, or at least I don't. My brother doesn't think I like to acknowledge it. And he took an X-ray, didn't see anything, but he says, "You know what, Alan? You never complain." He says, "Let's do an MRI tomorrow." Well, for me, tomorrow never came. What ended up taking my limb and almost my life was sepsis. And the cause of the sepsis was an infection of unknown origin. No open wounds, nothing. It was just popped up that
Now
quickly.
it's your turn, Dr. Mencia, to talk about sepsis and your patients with sepsis.
Well, sepsis can come from many things. And sepsis, the definition of sepsis is when you have bacteria overgrowth in the bloodstream. And the interesting part is when it's in the bloodstream, the blood runs all over your body from head to toe. So it can go into the brain, it can go around the heart, it can go inside the heart, the lung, or each and every organ will be affected, and usually it will kill people. So in Alan's case, when they found out that the main source was affecting his leg, the choice is continue antibiotic and hope you don't die, or amputate the leg, and we'll make sure that then the antibiotic will save your life. So it was a life or death situation.
Well, tell me that. So when you cut off the leg, why does that then you're just killing the infection in that part of it?
The main source of the infection.
Okay,
so let's say if a person has, which was not Alan's case, but if a person has an infection of the toes, and I get a lot of diabetic patients that come in with infection of their toes, and they are diabetic and ex-smoker or active smoker, and they have peripheral vascular disease. They have all the risk factor for a small infection to become a gangrene. And gangrene is when you have now dead tissue in your toes. Well, when you have dead tissue, that means that the blood flow will cease at that point. It will stop. So then the infection can progress to the bone, and that's osteomyelitis. Once you have osteomyelitis, and then you start getting gangrene or necrosis or dead tissue of the bone, the answer is going to be amputation. Now, you can be lucky enough to say, okay, it's localized to your big toes, and we're just going to amputate the big toe. But it might be so advanced that then they have to amputate either below the knee and above the knee. And the surgeon will make that decision based on several things. One, how is the blood flow? Do we have enough blood flow to amputate just the big toes and leave everything else behind? Or do we have to go below the knee because the peripheral vascular disease is so severe that we have to do below the knee amputation to do a good stump afterward?
Well, as a physician, though, and a geriatric physician, of course, if Alan had been your patient before, would you have been able to see what was going on before, or is that kind of mysterious thing that happens?
It's hard to
go back
to
and
be
so, of course, I'm sorry, that's an unfair
Monday,
question.
the Monday
right, quarterback.
But usually the recommendation and what we do at the office is preventive medicine. And that's why I saw a patient yesterday, and Thursday. And, the patient came in, we put him on antibiotic, and he's 92 years old. And he's concerned because he said, should I go to the hospital? I said, no, you're going to be okay. We're going to give you a shot. We're going to give you an antibiotic injection. We're going to give you oral antibiotic. But you have an open door with me, which means you can come anytime. You don't need an appointment. So when you have the doctor that is able to have an open door with your patient, as well as a patient that won't neglect a thing. Sometimes you have a patient that say, hey, I have this thing going on, but it can wait until Monday. Then Monday comes, and say, I think it feels a little bit better, so I'm just going to go and wait for my next appointment. That is Friday. So now you are delaying care. So, the take-home message is preventive. You have to be the smart consumer and knock on your doctor's door, whether you have an appointment or not, if you think it's urgent. And I'm not a believer on abusing the emergency care system. That's why I think primary care doctors need to be more proactive with their patient. Because, number one, the emergency room doesn't know you from a hole in the wall. Neither a outpatient urgent care center. They don't know anything about you, and they get paid very well. But your primary care doctor is the person that had the record on you and can go back and put the puzzle together usually.
Well, I want to ask Alan a couple of questions that I have heard. When you lost your limb, I've been told that you really think your limb is on. There's what's it called? The ghost?
It's phantom feelings.
Phantom feeling.
Mm-hmm.
Yeah. What is that like?
Well, you got to. I have the way I describe it to most patients. One of the quick questions is phantom pain and phantom feelings. There's nothing phantom about pain. Pain is real.
Right.
It's the perception of where the pain. Even to this day, being out almost 8 years, if I get an itch because I have a small irritation on my limb, well, I could perceive it as my ankle, my toes, my heel, and it's a very simple way to describe it to somebody that is not in the medical field. Imagine you have a switch on the wall and a light in the ceiling. You turn the switch on, the light comes on. You turn it off, the light goes off. Well, the same thing works. We have a wire that goes from the brain down to the big toe, and when they communicate, the brain says, oh, that's my connection to the big toe. Well, you hired a bad handyman to replace some ceiling tiles, and he cut the wire to the light. So even though the light switch thinks it's turning the light on and off, it's doing nothing. Well, now the brain is getting a signal from that same wire, except it's no longer at the big toe. If in my case, which I do have a spot on the side of my residual limb that if I touch to this day, feels like my big toe, and it sends a signal to the brain. Because when the surgeon did my surgery, he, what they call is bundles the nerves. They grab them, they're almost like rubber bands, cuts them, they retrieve back into the limb, but they're still alive, they're still active, they're still connected to the switchboard. So that's when you get your phantom feelings. To this day, if I drop something on the floor, and my cell phone, it was literally happened the other day, and my wife sees me laugh. She says, "What are you laughing?" I said, "Well, I dropped the cell phone above my right leg, but I wasn't wearing a prosthesis at the time, so I went to prevent it from hitting the floor and breaking the screen. And, of course, sticking my leg out, they didn't do too much." Okay? And this is the things that we live with, but I tell my fellow amputees, we have to embrace these things, not fear them. This is something that I actually talk freely about on a regular basis because to me, if I was to watch me in a mirror, it would have been pretty comical. Not that my life is a funny thing, but we have to have a little humor in life.
Absolutely.
We love having him come here. Thank you, Dr. Mencia, for doing this. The first time. This is a first for us, isn't it?
Yes.
And I like the idea that he has a coalition, it's a support group, isn't it?
Well, what it is I'm a representative of the Amputee Coalition of America. That's the national advocacy group for amputees throughout the nation, similar, not dissimilar to the American Heart or the Cancer Society. They're the ones that advocate for patients' rights as amputees. When I first became an amputee, my prosthetic company, which was South Beach Orthotics and Prosthetics, asked me, the owner, Mark, says, "Would you like to go talk to one of my patients? They're not handling like you do." So I said, "Sure, I'll go talk to them." And I went in to see the patient, and I came out and I called him on the phone immediately. He said, "What's the matter?" I said, "I saw the patient. They're doing pretty good now that I spoke to them, but," I says, "why am I feeling so good?" And he said, "You get it." And then coincidentally, about a week later, the coalition was running seminars on becoming a certified peer visitor, meaning an amputee going to talk to other amputees. And then I, through different courses, so now I'm a certified peer visitor and counselor. And I also, the next step, they invited me to become one of their trainers. So I train amputees to talk to amputees so that when somebody comes out of a surgery, it's not a blank staring looking at them in the face. Scary world.
How do you get involved with South Beach?
Well, believe it or not, the unusual thing or not unusual thing is there must be some sort of a jungle telegraph amongst the O&P companies when somebody gets a surgery. All of a sudden, the representatives, if the company does have them, all of a sudden appear. Because I was so ill, I was I was in intensive care for 2.5 months, and then another 2 months at medical floor, and then another 45 days at critical rehab. All of a sudden, when they realized that the turnaround time on a prosthesis wasn't there, they figured they'll get back to me. Except one gentleman from South Beach who just constantly, every couple of weeks came by, never mentioned a word about prosthetics, kept on asking me, "Hey, how you doing?" Because he knew I was in the hospital and it might be a lonely place. Would come in, a very animated guy, and right through until, when the day came that I was ready for my prosthesis, all of a sudden, once again, that jungle telegraph went out and they all showed up. And when they came in to see me, I basically dismissed everybody because my ethics, it's not about money. It's about the patient. And when I was in real estate for 20-something years, it was never about making a commission. It was always about making sure the buyer and the seller had a good deal. And then the system said I would get compensated. Now that I am in the prosthetic field, that same work ethic is there. It always, and South Beach has proven to me, otherwise I would have left them, day after day. It's not about just going and providing a prosthesis. They hired me as an outside consultant to go and talk to their patients. I technically don't make money for them, but I think I do. But
you said something that I didn't quite understand.
Yes.
That you had to be ready for the prosthesis.
Well,
what is all that?
Well, right off the bat, you have a surgery. You have to heal mentally and physically. You have to. My job while healing, I have a lot of our physicians and surgeons call me in to talk to patients because there's an urgency. Okay, the thought used to be, well, he'll wait the 3 months or 2 months, whatever it might be, to heal. Then we'll get in touch with a orthotic and prosthetic company and talk about prosthetics. No, there's an urgency there. The day to get involved is the 2-3 days before surgery, or even when they know there's surgery. I come in, I do pre-surgical consults. They don't tell them I'm an amputee. I come to speak to them, and the first thing I never do is I don't tell them whether she gets surgery or whether not get surgery. We just go in talking, and they get this, I call it the deer in the headlights look at me, and they might engage me out of just because first of all, they might be in pain, they might be scared, and then I engage them in conversation. I try to start, easing them. Now I'm getting that look, which I've seen after hundreds or maybe thousands of patients over the years. It's like, yeah, another two-legged guy telling me that my life is going to be okay. And I say, okay. And then I just before they get disengaged, I say to them, would you like to actually talk to an amputee? And I get a quick, immediate yes. And there's 2 reasons for that. The first reason is they think they just got rid of me. But there's a joke in my office. I have a middle name or a nickname. I'm the migraine, because once you get me, you can't get rid of me. Okay, so at that point I said, and then I know the second reason is they truly would like to talk to an amputee. So I take a step back, because most of the time they're either in a wheelchair, which, they have to look up, so they're not looking down below, and I never wear long pants. I always wear shorts, but shorts are just long enough to cover the top of the prosthesis. I step back, I says, so you want to meet an amputee? They said, yep. So I teased them. I said, let me pull my skirt up. And I lift up my pant leg or my short leg, and they said, what is that? I says, that's a prosthesis. I'm an amputee. How are you? Let me introduce myself. And they said, but they say, no, you walked in and you've been walking around, and I says, you just did my job. There is life after loss of limb. That's simple.
It's a beautiful prosthesis, though, I must say that.
And believe it or not, in no disrespect,
it has wrinkles. You see that? I mean, there are wrinkles in the knee and everything.
Wow. The funny thing is, this is for South Beach anyway, and most O&P companies, because there are a lot of good companies out there, that when they do produce them, and this is what we call, and this is one of my old ones, by the way. I'm building a new one right now. Yeah, I was teasing Dr. Mencia that I'd like to get new cars every year or two. So I try to keep up that thought with my prosthesis. Ladies have shoes in their closet lined up. My wife gets mad at me. She says, you got legs lined up. But this is pretty standard. Once they're all adjusted out and it's a final product, there are companies that will actually, I'm like a Mexican hairless because I have no hair on my other leg, but they'll actually put hair into the but that unfortunately is not covered by insurances.
That's extra.
Right. Yeah. But for me, this is good, plain, simple. It's functional, and that's how I am.
I think you are wonderful. And Dr. Mencia, you are wonderful because
and
you somehow you find the most interesting people for the radio show.
And when he told me, Alan, that if the person is at home, they will do a home visit.
Oh, this is huge. This is one of the
reasons.
I
said, Alan, we are together now. We're working together.
See,
excuse me, because you understand most doctors don't do what Dr. Mencia does.
Oh, no, that's why we're attracted to. 100%.
Yeah, he's very special.
Well, the unique thing about South Beach, and there's 1 or 2 other companies around, statewide that do it too, but they've been doing it for over a decade. They're a mobile platform. Could you imagine my wife? She's 100 pounds, but she's a personal trainer. She does kickboxing, Pilates. She's a tough bird. I wouldn't want to meet her on a dark alley. But could you imagine her trying to get me around? I was not well at the time, getting me to a prosthetic company for fittings, which could be 7, 8, 10 visits, till you get from the original evaluation through the final prosthesis and getting it delivered, and then 3, 4, 5 visits for adjustments afterwards. This is a burden on any amputee. South Beach goes to the patient, whether at home, a facility. And this, once again, is a huge the whole point is to bring back self-esteem, to get their self-worth up again. And this is when I come out, and this is why, I'm basically retired now. This is my pay it forward. I survived a very traumatic illness. Like Dr. Mencia said, most people don't survive sepsis.
Well, I want to give your phone number out. I think it's really important. Would the 404
yes,
be the one?
And that's right to me, by the way. That's not an office.
So for those of you, let's just say, if you are an amputee, if you're worried because of some problem you have, or you just want to know about it, why don't you call Alan Warman? That's Warman. The phone number, remember, it's Pencil Talk Radio. So it's 954-404-4313. Again, 954-404-4313. And if for some reason you lose it, call Dr. Mencia's office at AGI, and I got to do this too. The time goes so fast. AGI Medical and Dental Centers, Fort Lauderdale and Boynton Beach. And in Fort Lauderdale, it's 954-489-1345. 954-489-1345. And then Boynton Beach, it's 561-270-6494.
I was driving last Saturday after we closed the office, and I was driving around Fort Lauderdale looking for something for the house that I'm fixing up. And, I look at several doctors' offices. The parking lot is completely empty. And I say, oh, my God, there's some few doctors that were open on Saturday.
That's right.
Very few doctors. And for us to have the medical, the dental, today we have the podiatrist seeing patient.
Yeah, no, you were unique.
So
you've been
Alan,
doing
if
this
we
a
have
long
to do
time.
anything for the prosthesis below the ankle, the
Saturday.
podiatrist there.
Yep.
But now, and we don't have time, but prosthesis are arms.
Upper
there are
extremity.
Lots more things than we didn't really have a
Mechanical,
chance to
my
talk
electrics. I had the luxury of being, it's called the Biome, which is the first bionic foot manufactured. It's actually in the Smithsonian right now. I actually had worn one, and there's special applications when it's a great concept. For me, I was better off with a conventional foot, but this is something with myoelectrics and computerization.
I think this could be very interesting for the Cure Symposium, don't you?
Absolutely.
We put on twice a year a whole Cure Symposium.
I'm there. Not a problem.
Well, I have
Just
to tell
let me
you,
know.
this is wonderful for you to take your time and to come, and Dr. Mencia,
And
as
it
usual.
builds self-esteem. There are people that go to tragedy, and we didn't talk about all the dimension, the psychological impact of losing a limb and all of that. And he has really taken something like this and turned it around, and taking his past experience and then pay it forward. And I think I admire him for all of that.
Yes, because we have a lot of women who have mastectomies, and they have to have the same kind of counseling. Anybody that has something really serious that maybe is a little deforming of it's their self-image. And I can see you have this beautiful face. I can just look at your eyes and see how you help people. And I'm so glad you and Dr. Mencia have come together. And I guess that we have a couple of minutes, but is there something you would like to say to our listeners? Well,
also the other thing is that I specialize in, when I was in the hospital, everybody used to come in and say, Alan, how you doing? Alan, how you doing? And there's at the time, my 80-year-old mom, my wife, my stepdaughter coming in and helping me. And I said, it occurred to me, nobody asked them how they're doing. So I went ahead and got trained in taking care of caregivers. So not only do I give relief to actual amputees, I look at the whole family or the support group, because without caregivers, us ill people, and it could be not just loss of limb, anybody that has a major catastrophe with illness, they depend, especially in our geriatric population here in South Florida, on caregivers.
Yes.
You're wonderful to mention that.
That is wonderful, because when I see my geriatric patient, a lot of time I turn around and look at the caregiver and ask the caregiver, well, how you doing? You know how many tears come out when sometimes we say to the caregiver, well, how are you doing? Like, oh my God, so
somebody
I
cares.
am important.
Well, thank you very much. Alan Warman, a wonderful, wonderful guest. Thanks to Dr. Mencia in the wonderful world of wellness. Alan Warman can be reached at 954-404-4313. 4313 South Beach Orthotics and Prosthetics, and he's also counseling the Amputee Coalition. We certainly appreciate your being a guest this morning.
I appreciate you having me here, and I thank Dr. Mencia for inviting me.
We'll bring you again. I mean, this is really a lot more to talk about.
This is what I do all day, all night.
We'll be right back.
Marianne.
We'll be right back. Just stay with us.
Before
okay?
we leave, I just want to say to Alan, thank you so much for what you do.
Thank
for all
you,
those
thank
people.
you, thank you. I agree.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.